Eyes are on our nation's hospitals now, hoping to keep COVID-19 from overwhelming our healthcare system. And joining me today is the Chief Medical Officer for CHI St. Alexis in Bismarck, Dr. Lisa Laurent. Thank you for being here today. Now, we know the next few weeks of isolation are critical to preventing a spike in coronavirus cases, but with no vaccine and no cure, how will we really stop the spread of COVID-19 and if we erase certain restrictions in the long term?
Thank you for having me, Lauren. First, I'd like to speak to the communities of Bismarck. Please stay calm. Your healthcare professionals at CHI St. Alexius Health are fully prepared and trained and skilled to mitigate COVID-19. The best thing we can do to keep that pandemic curve flat, if you will, is to begin to practice and continue to practice safe distancing, vigilant hand washing. Please, as a community, refrain from going to large congregate areas where there'll be several of you. Refrain from touching your face. Disinfect your kitchens and bathrooms. Have food and other products delivered to your home as much as possible. Please sanitize your kitchens and bathrooms regularly and sanitize your electronic handheld devices and any device or piece of equipment at your workstation. We are asking you as healthcare providers, the best thing you can do to help keep us safe is if you stay home and exercise best practices.
Okay, now that we have 4 hospitalizations, what's being done to keep staff safe?
So I'm thrilled to report that our staff is extremely well educated and highly skilled in how to keep themselves safe. They understand all the policies and procedures and protocols that go into personal protective equipment, their respirators. They understand all of the safe precautions that are necessary in handling all types of patients. We are mitigating our risk at the hospital by limiting the access into the hospital, limiting magazines and newspapers in our common congregate areas, limiting the type of food in the cafeteria, although it's provided for all our patients, visitors, and associates. And also making sure that all of our visitors who come to the hospital are screened, as well as all of our physicians, nurses, providers, and associates are being screened before they enter the hospital.
And Dr. Lisa Laurent, thank you so much for taking the time to be here with us today.
Thank you, my pleasure.
Nicholas.
And tonight's Your Health First, taking those extra steps now to make sure we're disinfecting surfaces properly. Hand washing is important, and so is wiping down surfaces, but there is one thing we may be neglecting: our phones. We spoke to a resident